People don't choose to have mental health issues. Mental health challenges is not a choice. But how we respond to them is a choice.
The viral video of a Shelby police officer repeatedly punching a woman during an arrest has now drawn the attention of one of the nation's most prominent civil rights attorneys. Thanks for staying with us. It's On Your Side tonight at 7:30. I'm Jamie Bowl.
And I'm Kim Anderson. Today, attorney Ben Crump spoke for the first time alongside Cherrie Moore and her family since news broke yesterday that he would be representing her. Now, the officer seen in that video, former Shelby police officer Carson Hyder, has been fired and charged with misdemeanor assault. We were there as he appeared in court this morning.
Now, at the same time, court records show 2 charges originally filed against Moore, resisting a public officer, and assault on a government official have now been dropped. But tonight, a breaking and entering charge does remain active. But during today's news conference, Crump argued the case raises larger questions about how law enforcement responds to people experiencing a mental health crisis. Friday's doorbell camera video captured Moore repeatedly asking officers for help in the moments after she was seen beaten by Hyder.
Can you take me to mental health or something? I'm not on medication. Can you call my daddy? I'm not on my medication.
Now, during this afternoon's news conference, it was revealed by Crump that Moore has been diagnosed with schizophrenia and bipolar disorder.
She has mental health issues, and that's not a crime. Ms. Moore saying, I don't have a warrant, excuse me. She had the demeanor to de-escalate, and it seems like it was the police officer that was escalating the situation.
Well, Crump argued officers should have recognized signs of a mental health crisis and worked to de-escalate the situation, but he also pointed to injuries Moore allegedly suffered during the arrest.
A mental health crisis should not equal a broken nose and a busted lip and black eyes. The officer should be held accountable for each punch.
Crump says medical records show Moore suffered a fractured nose, black eyes, and swelling. His legal team is now calling for prosecutors to consider increasing the charge against Hyder from simple assault to assault inflicting serious bodily injury.
The attorney also questioned whether departments should have specialized mental health resources available when officers encounter someone in crisis. Now, WBTV has reached out to Shelby Police asking whether officers receive crisis intervention training, whether the department has specific mental health response policies, and whether any changes are being considered following this incident. Right now, we are still waiting to hear back to get answers to those questions. Now, we do want to note, of course, though, that Shelby's police department is smaller than many in the area. Specialized mental health response programs and crisis intervention resources, they're not available in every department nationwide. They vary widely from agency to agency. Many departments rely on additional funding sources and partnerships to build those programs. We do know other departments in our area have these kinds of services available. For example, Cleveland County Sheriff's Office offers crisis intervention resources, though its deputies were not involved in this incident. As questions continue about how this encounter was handled, the Shelby Police Department's own mission statement offers some insight into the standards the agency says it strives to uphold. It reads in part, the Shelby Police Department will support and defend a safe environment for all citizens by demonstrating passion and compassion for the common good. We will exercise fairness, integrity, and ethical behavior that will result in collaborative communities who trust and respect individual needs and differences. During a brief news conference Friday, department leaders publicly condemned the actions of now fired officer Carson Hyder.
As seen in the video currently circulating on social media, the actions taken by one of our officers during that encounter are disturbing and inappropriate.
But some argue his firing is not enough, and for now, the State Bureau of Investigation will continue looking into how the arrest was handled.
In the meantime, attorney Ben Crump says his legal team is pushing not only for accountability in this case, but for changes in how law enforcement responds to people experiencing mental health crisis.